Miller, Megan Vaughn. So Lisa's full-time faculty, pediatric content. Megan is part, I don't know what percent. 40. Okay, and also treats clinically at early intervention. Okay, so Megan Vaughn, and then Chelsea Van Zieveld, and she has, as of pretty much today, gotten her PCS case accepted for publication.
Cool.
How many years? How many years later? Yeah, almost done with it.
Determination.
Yeah.
Yeah, awesome.
So she's been doing a lot of work on writing and all those things, and we thought she'd be a great addition to coming together with the script. And she's going to be working with Katie, who you might not even have.
She overlapped when I was here.
Okay, all right. So you know Katie.
I don't know her.
Okay. So and then Catherine Billieu, who is new to the faculty and has outpatient ortho background and is doing clin ed and various other things. Denise Delsner, who unfortunately will be retiring soon, but she was willing to do one last round of this.
Oh, we have Little League.
No.
Kidding.
Of course it drops right in the computer. Yeah, look.
No.
That's hysterical.
Of course, Megan was like, yeah, and it's on the right person, too.
Sorry, guy. We just got a leak dropping from the
Sorry,
ceiling
we
on the
got-
computer.
yeah.
Of all the
That's
places.
exciting. Let me go get the paper towel. I'll be back.
Okay. That's hilarious. Okay. Yeah.
Let me go down and tell the library people.
Sure. At least a bucket, huh? All right, so Kyle Ridgway, he graduated a few years ago. He's been involved in the PCS process, I think 1, 2, and 3 at various places along the way. Dan Malone, full-time faculty, also been involved in PCS for a few years here. Mike Body, who was involved in PCS and then left and then came back. Just recently. And he is the track coordinator for the clinical reasoning content. And then we have a new guy here that knows some of you, but not all of you. So Toby Kinney. He has been slowly but surely eking his way into various faculty roles. He has experience teaching at the University of Montana and is now part-time clinical practice at UCH Sports Clinic and is involved in both integrated practice class this summer as well as Capstone. So Lisa went to tell them that. Yeah.
I'll just do this.
Just do keep doing that.
Yeah.
Okay. So we want to make sure that this is.
Guys, fine.
So the precursor capstone course was Patient Care Seminar 3, and this morning I presented his poster because his wife went into labor just before his poster was being presented last week. So he was officially the last one to present, and so we're all finished with that. And while there were some really positive things about PCS, I think there were some things along the way that we identified that could be improved upon. One of the biggest challenges was that they were trying to do all this work while they were in full-time clinic, and we were doing everything remotely. And at some point, there's limits to what you can do when you're doing everything remotely. So we decided to move this into an on-site class, and we're going to talk about the students have actually already selected their cases because of how the curriculum is set up. We had to have them do that in C2. What other big things? So we've gone to more of a peer review as opposed to all instructor review process. This is a new idea, and we'll see how it ends up working out. But one of the ideas with that is to reduce instructor workload, and hopefully that is effective at doing that. We'll see. And what else? Those are probably the biggest things. And Amy and I are the co-coordinators of the Capstone, what is now called Clinical Reasoning Capstone course. Trying this summer break. So taking a step back, what do the students have? This is in the new curriculum. The classes that used to be called scientific inquiry or some version of that have now been replaced. So there is fall semester evidence-based practice, and by the way, Mike is involved in all of these in various levels. So evidence-based practice, in the second semester, clinical reasoning 1 in the third semester, 5th semester, clinical reasoning 2, 6th semester, which they just got finished with. The beginning is clinical reasoning, clinical education is ongoing simultaneously with clinical reasoning 3 in the first 10 weeks of the semester. And then they came back and did some work that we're going to talk about here in a second. And then we're about to head into summer 3, which is the 7th semester of the capstone. You want to make sure you can hear? It's good. All right, so like I said, the students have already selected their cases, because once they go out into their final clinicals, they don't come back to campus other than for graduation. And one of our goals was to have an on-site class. So we had them select from 3 cases that they worked on as part of clinical reasoning 3 in that first 10 weeks of their spring 2. They did group discussion cases on prognosis, examination, and intervention. So they've already done some work on cases and participated in some peer review process and discussion boards. And then when they came back, we had them do small peer review groups, discuss the 3 cases, and sometimes they only had 2 good cases to choose from. But they had discussions and decided amongst the peer group what their case was going to be. Yep.
Is it okay to ask questions?
Yeah, sure.
So I just want to ask Mike this.
It's not my show today.
I'm sorry? It's not my show today.
It's not just it has been fun. I'm in the audience. I'm in the audience. Remember that question.
So they had group discussion cases, prognosis, examination, and intervention. So in that examination portion, is there also a reasoning to the narrative component, exposure to the case, to the history,
All cases, so all 3 of these are different cases when they presented, and all 3 of them involved a brief subjective kind of case overview of the patient and a little bit of a lead in to why they chose that question for that given patient. Does that answer your question?
Yeah, but so not really taking that information into the case to reason as well, the information from the history?
Yeah, and I think what's important to say is that they haven't done the examination part of the capstone. They asked a question related to a patient they were seeing related to examination.
Like how sensitive is the tug and the detecting fall risk in a 74-year-old female with a recent TBI?
Or what pediatric exam should I use for a child with this such and such condition? So those kinds of questions.
Yeah, and so it's a very focused question. So even so within the exam, they only present a very kind of limited overview in CR3, and then they have a question that naturally stems from what they did present, and it's a very focal answer with application to that patient, but only for that very minute
But
part.
only the physical exam part of exam.
It doesn't have to be. They could have asked a question about, does this thing in the history correlate with this thing in the, I mean, they could ask them
Or
that.
is this
I would
something
say
the
that-
patient's even interested in?
Well, and that's in the rubric that we will be tackling.
Okay.
So, so
They
let,
did do some work
so-
on that
yeah.
later, but not necessarily in the CR3 class.
Okay, perfect.
Yeah, I think that's it.
They're like,
Okay. And then they also, before they left this for the semester, they had working sessions to help them complete the ICF diagram. And for those who haven't been involved in the revision of the curriculum, there's been a focus on Katrina actually developed an ICF working document, and then the clinical reasoning track in particular, but also some of the management tracks have used that as part of decision-making, using it as kind of a decision-making framework. So they have completed an ICF diagram on the case that they selected. They have developed a rough, I would say some rougher than others, outline. And they have also developed a draft reference list. Okay, so if they think, this particular test and measure I think is going to be really important, they might have 3 references already in their reference list. The idea with this is that this summer is going to go really fast. And so we wanted them to be ready to go day one and do some pre-work on the case. And they have submitted all of them. And either you have a little jump drive right now, or you have access to the shared drive, and we will send you the link on how you get to the shared drive location of the Capstone course, and the documents are under your name. And we did that so that we weren't emailing you 27 documents and have you open that.
And
say, "I'm not sure
basically,
if I really want to participate."
it's the student's last name, ICF, then the student's last name, outline, last name, reference list. Okay, so that's, hopefully you will see.
And so in advance of the start of the course, or in advance of the Wednesday the 8th, which is the first time you guys will be participating in class, we would like you to go over those, become familiar with the cases, start to kind of identify areas where you're like, this doesn't seem like they're going the right direction, or I might need to ask them some questions about this, that kind of thing. So you're familiar with it when you come in that Wednesday. So the summer schedule overall, there's going to be 3 sessions a week. So there's going to be a Monday working session, and there's also going to be dedicated writing center hours that are ongoing an hour or during that Monday session, 3 to 5, as well as it's 3 hours long, so 3 to 6 total. And we'll talk about that in just a second. And Amy and I are going to be at every one of those sessions. And then Wednesday is when all you guys are going to be there. Okay, that's a 2 to 5 session. All the instructors are going to be present, and we're going to talk in more detail about that in a minute. And then we're going to have an optional working session on Friday. What does that mean? Okay, just want to make sure. Okay, so every Friday, about every other week, we have a working session so that if they're struggling with something, either Amy or I are going to be in that session. And there's also dedicated writing center hours available then. So that's an 8 to 10 class, and those writing center hours are 7 to 10 on that day as well. So next slide is a little overwhelming. I'm not going to go through every one of these. Okay, but this is every week, background, okay. Pretty similar to the types of things you would have seen for patient care seminar if you're involved in that. Okay, but I'm going to highlight a couple of weeks here. So you might recall, for those who have been involved in PCS, that the way we did submissions in PCS 3 is that they would do the examination, and then they would get feedback, and then they would submit the revised examination together with the evaluation, get feedback, okay, so that was a growing paper. So that's very labor intensive for the instructor. And so what we've decided is to submit only a section, and that's the only thing they're going to get, they're going to work on, the only thing they're going to get their feedback on from their peers primarily. And then because it just kind of worked out fortuitously here, the 4th of July week is kind of messed up because there's no class on Monday. And so we actually are doing 2 things during these 2 weeks. The first is teach them how to do a poster and have them start designing their poster based on the first half of information they have, as well as getting them to compile the sections that they have so far and work on transitions and flow so that it kind of makes sense. So we're going to have kind of a center point here where it's a stop developing new content, make sure your current content is adequate before you move forward.
Tammy, it might, they may want to look at page 8 of the syllabus because that's actually exactly what Tammy's going through, and you can see how it'll actually roll out.
So each week, we're going to have these peer review sessions, and actually that's more details on it. So, okay. What you have in front of you in the syllabus is what the students will get. Thanks. Okay. Monday, Wednesday, Friday, Monday, Wednesday, Friday, all the way through. Okay. And an example of what a Wednesday session might look like, we're going to use the example of the examination. Okay, Amy's going to give out a little bit more. So on Monday by 8 a.m., they have to submit a draft. Probably not going to use the term draft because that's get us into trouble in the first place. First did earlier, but so the first version of their examination is due at 8 a.m. That day, they're going to have an in-class working session where they are within their group of 7, paired with one other individual or a group of 3, a dyad or a triad. They're going to have 2 hours in that working session to work on good, solid peer review information that they're then going to share later on with their peer.
I just gave them what the Wednesday's going to look like.
Okay.
If you do want to.
Sure.
All right.
So when we first, and Mike, this actually might be new to you as well. When we first put together the capstone, when Katrina was first putting it together, it was very much like background, examination, including, and a few words, okay? And that's all the students have gotten so far, okay? Is this very brief list. And we found out in a hurry in these working sessions, they had no idea what went in the background. They have no idea what goes in the examination. They have no, and that's, you know, thinking back, that's why we created all this detail in Patient Care Seminar 3. So we expanded from a very basic list to more specifics for them to go off of when they're writing their sections.
And so if you notice that, then on Wednesday, so if you'll notice your exam, it says week 2 development, week 3 peer review. So they will have this working on it week 2 when they go to their working session, and they'll know what they need to have in their exam. Then they'll come back the next Wednesday, and that's where 1 or 2 other peers will have reviewed their work as well as us, and then they will give them their feedback on whether you hit this. And if you'll look on the back page, we are asking them, and this came from Drew Bixby in the Writing Center. It says these are 3 questions they need to ask. So it is praise, something they did well, what makes sense in their exam, what do you still have questions on, and what do you need to do to polish this to make this a real good project. So that's what we're asking the students to give peer feedback on, 1 at most 2 documents, okay? And then they do it on the content and the writing. And then what we put here is for the student to have a plan of how they're going to tackle this. That may be going to the writing center because their writing's really not going well. That means I need some more articles on this. So this is trying to give some structure to our Wednesday sessions. Does that make sense? Okay.
So Wednesday, they're going to have the first 45 minutes to one-on-one or two-on-one, get feedback on their submission. Okay. Then they're going to come back into their groups of 7. And so this is an example for week 3. Okay. So we're going to have them each individually present their prioritized 2 tests and measures, for instance, okay, in that group of 7. And then there's going to be a broader discussion in the group of 7 about that test and measures. Does that seem like that's appropriate? Any thoughts from the group on that? Okay. And then there's going to be a brief discussion of that. And then the next person's going to go on and present. Okay.
Denise?
Sammy, do you see us sort of walking around, listening to the 2 and 2,
Yes,
listening to the group of 7?
exactly.
And just and so we have someone who's run small group sessions with the School of Medicine and Academy of Medical Educators. She's joining us around 3:10, and she's going to give us some hints on how to do that. So that's going to be part of our role. Thank you.
Okay. So it's a little bit unclear exactly what our role is going to be in this kind of, you know. So when they're doing one-on-one, they might ask us questions, or we might just listen in. We might contribute. We might just let them roll with it. Okay. If it lasts 10 minutes and they're done, we might want to step in and kind of help them to maybe develop that peer review a little bit more. Okay. So roughly 45 minutes. Okay. And then when we come back into the groups, that's going to take another hour, something like that. Okay. And then they're going to have some working time to think about the peer review that they received and start to incorporate it into the draft that they have turned in on Monday. Okay. So it's kind of growing. Then on Friday, they actually have do that revised, semi-finished version of whatever they were working on. Okay. So they basically are working on it through the course of the week. They might have a working session on Friday morning. They might do it on their own time. In this summer, you guys that have worked a fair amount on summer 3 schedule, they actually have a fair amount of open time for working on things, which is great. Okay.
Mike, that was a question.
Yeah.
So when we as faculty are reviewing these cases in preparation, when do we give our feedback? Is it really kind of in that presentation? We see what they came up with
Yeah, so it's a really good question, and in the spirit of trying to reduce faculty workload, the plan is that you are going to review, you might jot down a few things, but you're coming prepared to give verbal feedback. You're not grading it. You're kind of coming in prepared to kind of point a few things out, right? Okay. And actually, then on Friday when they submit that next version, you need to do the same thing. Look over it, make sure that they seem like they're on track. Okay. You might decide at that point that a writing center referral is appropriate. You might decide at that time that a one-on-one meeting outside of this session is appropriate. You might decide that that they need to meet with me, which I'm the resource person if you're kind of struggling with somebody. And I'm absolutely happy to do that. That sounded like I was the heavy right there, and that's not the intention at all, of course.
But never written.
Well, there, yeah, hang on.
What's your threshold for a writing center?
So she's got some of that too.
Oh, okay.
Hold on, it's coming.
Yep.
No,
Okay.
actually, no, we don't.
And each class again is how long?
3 hours.
3 hours.
So we're anticipating maybe about an hour for some of the shorter sessions to do the peer review for the short, but the exam's probably going to take an hour and a half because it's got so much. But most will be about an hour in peer review, and then it depends on what we need to add to it. And then their working sessions and their bigger group discussions should probably take the next 2 hours. That's what we're anticipating. But y'all are in charge of your own rooms.
Right, and that's
Somewhat.
up here in just a second. So, by the way, we're going to be in the small group rooms on the first floor of Ed 1. So, rooms that are about maybe a third the size of this with a single center table. And so it should be pretty intimate, and you're going to be running your room however you want to run your room.
Are they watertight?
Are they watertight? None of them are on the third floor. So that's
Mine
good.
is.
Except for Amy's.
Thank
Ran
you.
out of room.
All of them have rooms to live.
Okay, so let's kind of go through your responsibilities each week. I started to touch on this a little bit. You're going to check Canvas on Monday, just make sure everybody submitted what they were supposed to submit. Katrina right now is working on the structure of Canvas, so we should be able to tell you about that next week. So you're going to check Canvas, and if they didn't submit something, then you're going to communicate with them and say, where's your submission? Okay, because everyone else is pretty paralyzed with moving forward with the next, their responsibilities if the student doesn't turn it in. Okay? They might turn it in at, Saturday at noon, but don't care as long as it's in there by 8 o'clock in the morning on Monday.
The question about that, should there be, since there's 2 people focused on, should there be one lead person who's the communicator, or?
Yeah, and so you guys can work that out. However, the first person on the list, and I'll say the exception of this is Kyle and Dan, but the first person on the list is going to be there the vast majority of the sessions. And so we would like for them to be the lead person, and how exactly that is worked out. So Megan's the lead in that situation. So you guys obviously can work it out, exactly how you want to do that. Maybe you would take certain responsibilities and she would take certain responsibilities, whatever you want to do with that, okay? Okay, so you're going to review the 7 sections that are submitted, and we recommend on the first week that you both review all of the sections so that you kind of get a feel for what's going on, okay? After that first week, it's up to you guys if you want to split the group and one of you does 3 and the other does 4. If you're really consistent in your groupings, that should be fine, okay? If there's a lot of variation, that's going to be harder, and that just puts a little bit more onto the lead person. Wednesday, you're prepared to facilitate the small groups, and then between Friday when they submit that the final section and the next Tuesday, right, you're going to look at it again, make sure there's not any major issues, and decide if there needs to be a one-on-one meeting. Okay, is that clear? We kind of went back and forth a couple of times. The only time that you're going to provide written feedback, unless it's at your discretion, but you're not required to do written feedback, except for in those middle 2 section weeks 5 and 6, where they're compiling things together and they're starting to put their poster together. And then at the end of the semester, when they're bringing it all together, weeks 8 and 9, you're going to provide written feedback at that point. So questions up to that point?
Do you have Friday to next Tuesday, on that previous slide. So even though they're submitted on Monday, they're like officially.
Right, so the draft is submitted on Monday. That's going to be what they're working on during the week,
Right.
okay? Friday, they're going to submit something that they see as pretty close to final, okay? So you're going to take a look at that, and if you're like, wow, they got all this peer feedback that this section really needed a lot of work and they didn't do anything, that would be a time when you're going to communicate with them, you know, that they need to work more on that section, and you might give them a new deadline that they need to work on it over the weekend, or by the next week they need to really have refined that section, for instance.
And if you look at page,
Peer feedback that you're talking about comes in what form? Because when the peers give each other feedback, are they just doing that and talking? So we're assuming they got a lot of peer feedback. There's nothing right in this.
yeah, and that's part,
Using
that's,
this as
yes,
well.
that's what they use each week to guide them.
So they will have, and I think, you know, we can require that it's in writing, but that they discuss it as well. But I think it's fair to expect, considering we're giving them 2 hours in class to work on it, that they have some written
Yes.
things for the peer to take back when they start to do the revisions.
And that was the point of this, is each week they'll have one of these, and so they can guide themselves on how they go.
But will we have access to what they've done?
Yes. Yes.
You know, we're not having them submit it, but in class, I mean, we can decide the best way, you know, what the best is, because we are, as faculty, rating them on their
Yeah.
participation in the peer review process.
Right, because what your last statement was that on Friday, when they submit that, if it doesn't look that good, and yet they had all this peer feedback, I'm not seeing any peer feedback because.
Well, but you're going to be present in this very small room.
Yes,
So it's based on me hearing,
Yes.
us hearing what's going on in the room.
Exactly.
and that's why, and we're going to talk about some strategies to actually capitalize on their discussions. So I envision, Denise, me writing notes of what Alyssa says to Jackie. That's kind of what I anticipate me doing. Okay. And what, maybe coming back, Lisa, if you look at page 8 of the syllabus, when it says revised background, that is when they've done their peer review. So then between Friday, when it's due at 5, and the next Tuesday is when you can give final comments, et cetera. That's what she means by the Friday to the Tuesday. Does that, okay. 8, page 8, everybody there. Week 2, revised background due. Okay, that is the background where they got feedback from their peers and us. So we have from Friday at 5 to really before class starts on Wednesday, if you want, to make sure they did what we asked them to, if it's on track, doing where we need to go. So it's kind of like we have a little bit of overlap. But this should be pretty easy because we already know what we thought were concerns, and the peers have already given them feedback. So it should be a pretty good polished version by then. Does that make sense?
Every week we should be looking for a revised section that they submitted as well as.
And then what's the next one? Yeah, does that make sense? So it's kind of, but again, not to overwhelm you, the written only truly has to come here unless you see a big problem. And what we want to say again, if it's a big problem in writing center. If it's a big problem and are they doing what they're supposed to, then either I can't really help during Wednesday because I'm on my own with Katrina as an internet backup. So, but Tammy could help in the moment, but I could help also outside of class. Okay. Does that help make some sense of what? Okay.
This is Carrie Lamb, by the way, for those of you that have not met her. So she is going to be working with Dana and Mark Monago. Dana's going to be lead on that group, and she should be here any minute now, hopefully. She's involved in some graduation things, so she looks like she's running a little bit late. So you're kind of coming in the middle, so no guarantee that this is going to make a lot of sense at this point.
2000.
Okay, 2000 grad, 2011, 2013.
I did graduate.
Well, wait a minute, Kyle.
And we have Guy Lev.
Guy's on here, yeah.
So he's a grad. So are the instructor responsibilities pretty clear? All right, so we are trusting a lot in this peer review process. And, you know, hopefully it will work out as well as we're.
But actually, while Tammy's there, if you look at, Tammy, I'm sorry to keep interrupting you. Page 7, while we're talking about peer review. Megan, sorry, I just know somebody might need this. I don't mean, but page 7, peer review. This is an art. Denise actually sent me this article from medicine on how to give peer feedback. So we have 2 points, reasons for this.
These are in. This is
Well, it's twofold.
Director.
It's twofold.
Okay. Go ahead.
So twofold, okay? One is we want the students to see this, to know what feedback really looks like. It's not, you did a good job, Mike. You're fine.
Compliment sandwich.
You're done,
Compliment sandwich,
okay?
exactly.
But no, can they support what they said? Are they just winging it? So we're trying to give them some words to know what decent feedback looks like, not just,
Nice job, explanation.
yeah. So that was part. So,
Historically, that's been a problem.
Yeah.
So we need to figure out a way to not have that be the thing.
So that's why we wanted the students to see this. And what Tammy's referring to is we will do 2 points. One is a formative about midway in the semester where we'll give them a written assessment of how we think they're doing. That's formative, not for a grade. And then in the final week, we will give them a written grade based on this rubric. Does that make sense? So we actually are giving them a chance to change their behaviors if they don't actually get it. And so that's why Tammy's saying that's where we will use it, but we also want the students to know what we were grading them on.
A bit of a digression, but people, they kind of go through this process of ICE at the clinical standpoint, right? And I forget, because I did ICE the first time I did this time, did they get like some resources on how to provide peer feedback? I forget. Or did they have a session on it? 'Cause that was a big
Yeah, they
part.
did, yeah.
Was that peer-to-peer feedback?
I think they have a session on that, and then they're doing some written material as well.
And so Tammy and I are planning on that Monday, the 6th, to go back over this and say, what do we need to do and how do you give feedback and what are we looking for when you give feedback and so we're going back again.
Is there any like reference from ICE?
You can tell me.
Well, check 80. I don't remember what we used for it.
I just.
Well, if
Like
the
them
students are gonna be using this,
Yes.
we've got the reference to the full article.
Yeah.
And you're gonna go over this with them?
Yes.
again?
Yep, on the first day, we're going
Yeah.
Can you
to kind
have
of course expectation.
add a description of the range if 1 is high and 5 is low, or what it is?
Well, that's what, if you look on the left, exceptional,
No, yeah, and low.
Oh, I see.
you know what the numbers are flipped. But
I
we'll fix that.
noticed.
Oh, yeah, I do need to fix that. Thank you. They are flipped.
Removed the item that said I have
Respect.
concerns about this person treating patients. So, do you remember that item that was on
There was.
the article?
Yeah.
Yeah, I know, I did take that off.
What we wanted to do is to have 10. So that
But so
came
it'd
out
be
a
easy
nice,
add, but
neat
no, I
number.
need to flip the numbers, so y'all just ignore me, I got my numbers backwards.
Okay.
Nobody else told me
Okay,
that?
so,
My proofers.
couple other kind of miscellaneous things. So we are revising slightly how we're doing posters currently for PCS3. By the way, at the end of this session, you're welcome to join the PCS3 poster session, which is ongoing downstairs at 5 o'clock, to see examples of what the work that has been done so far in PCS3. We are going to a single template. It has to be CU color compliant. That was a big thing. And on July 6th, which is that one, the beginning of that middle week, the July 4th week, I'm going to do an instructional session on how to create a poster, which they've never had before in any other classes, and it's always been kind of like making it up as they go along. Okay. They're going to have another working session on that. They're going to individually present them. We're going to do presentations exactly like we've done in PCS3. That seems to have worked pretty well.
Sorry,
While
Tammy.
you're switching up here a little bit on that poster, one on July 4th week. Who's telling them how to put posters together?
Me.
That's what I said. Not us.
So, we're going to do a session on that, and then so we'll decide when we get closer to that, what it feels like as far as the amount of time that the instructors need to be there. I think if they've done a ton of posters themselves, they probably don't need to be in the instructional part of it. If they haven't done a lot, it's actually probably good because they're going to be given, feedback on the posters.
So with the
we'll talk a little
posters,
more about that.
are you gonna standardize, or I'm assuming most of them are gonna choose the same components, but is each poster gonna have the same headings, if you will?
Mhm.
Yeah. Yep. And I think that's, part of reducing the workload is just being very concrete into what the expectations are, what you're going to have on there. And so I think that's a good change. It, makes it a little more boring from a visual standpoint, but at the same time, I think it kind of makes sense. So, and then what are you guys going to have to do as far as from a grading standpoint? So along the way, you're going to be keeping a running tally of the quality of the first submission. And so if they are turning in something that is really not developed at all, they should be penalized for that from a grading standpoint on that. So there's it's going to be out of 100 and you're going to turn it in at the end. You're going to put it in Canvas at the end, but you should be having a running tally along the way. At midterm, you're going to be doing the formative feedback form that Amy showed you about, are they participating appropriately in the peer review process? Okay. And then at the end, you're going to do summative feedback on that. So you're actually going to grade them on that. You're going to give them a final paper grade, a final poster and presentation grade, and then a grade on incorporation of feedback into all products. Okay? All right. A few miscellaneous topics. So we've talked about the Writing Center along the way. We've gotten funding to have dedicated Writing Center hours. We're still working a little bit on how do you keep the strong writers from monopolizing the hours in the Writing Center, which we know would not be surprising. And so we're working with Drew in the Writing Center exactly how to go about that. You can, as an instructor, require that they seek Writing Center hours. If you've ever worked with the Writing Center, they do a great job of kind of teaching, I guess, teaching someone to fish, right? So as opposed to editing everything, they're like, looking for trends and teaching people how to correct structure and things like that, or things that commonly they're doing along the way. Okay, so we have that. We have dedicated, and those hours are actually going to be in one of the little small glass rooms right outside of the classroom. Okay, so we're trying to make it as easy as possible for those to be used. For the first time, the Writing Center is also providing hours in the library in the summer, which they've never done before. So that's another option if those other hours are filled up. They also have online synchronous hours. So in the evening, they can be chatting back and forth with an instructor at the Writing Center, getting help on something they submitted. They have this great Dropbox function, which I think we should require everyone to do at least once along the way. Okay, so basically they just submit their paper and they get feedback 3 days later. So it's not very timely, but even if you're a good writer, they might be able to find something that can help you. Okay, so we do know that there's a group of about 12 students who have been identified based on an early writing assignment as being challenged in their writing. While some of those individuals improved some with the second writing assignment, I think it's clear that this is not an area of strength for them. So we have divided them out. And so the email that I sent you, there were a few students that were highlighted. I started out removing the highlighting, and I just left it in there. So those are your students that are challenged. Okay, so some of you have highlighted students.
You don't.
There's no more than 2 per group. And you pediatric people, you don't have any.
Y'all are so special.
Yeah, that's something special about it.
And actually, yeah.
all the strong writers go to pediatrics. Okay. So I emailed you guys about letting me know that you do indeed have Canvas access. There's been a few issues along the way. What I don't want to happen is this happened in PCS3 in the past, which is you get to the end of the semester and then you tell me that you don't have access. So you need.
Speaking for
Kyle. So you just went rogue all semester.
So please, because there's actually you can't participate as an instructor without Canvas access because that's where they're submitting all their documents. So that wasn't only corrected.
You owned it. I'm proud of you.
We have also required that they have EndNote or some other form of referencing software. They have to have that. So if you notice that they don't, you might remind them that they need to at least get EndNote, what's called EndNote Basic now. It used to be the EndNote Web. It's free. Okay. They are not going to have time. They have so many things to work on in such a short period of time to be, reordering references and all of those kind of things. So, and the library, if they, so two things. There are some references already on the Canvas site. A handout that's specific to both PC and Mac. And they also have dedicated librarians that can sit down with them and help them to put it together if they're struggling with that, especially if we're not comfortable with that. There's also some documents on Canvas that the Writing Center has put together specifically about active versus passive voice, concision in writing. Like they have a whole list of words you should never use and words that you should use instead of those really flowery words, which is kind of nice. And the Writing Center actually presented that to the students during this semester. So they have that and they have handouts. There are also a bunch of sample case reports and we, on the first day, are going to refer them to a couple of different things, like if you're trying to figure out what goes into a background, well, let's look at Jim Hedgecock's paper that was published out of his PCS3 case. What did he put in his background, and what can they learn from that? So there's a bunch of case reports, but Beth Ann Carlson's, which came out of the TDPT PCS, is an example. That's an anorexia nervosa case, and then Jim Hedgecock's strength training in the WCP.
Can I ask one question too?
Yeah.
Does it matter if it's like first person or third person? Or
It shouldn't be first person, and that's
Or
part.
first, right?
That's part of what those things he talked to them about is what should we put it in. So
Yeah,
That's how I've always done it.
Yeah.
But
yeah, and so we're asking them to follow that.
and past tense. And actually, one of the other things I didn't put up here, I've started to compile a hints sheet, like common things that come up with pretty much every student for the last 10 years. So I'm putting that together, and that will be on Canvas as a hint sheet, and the students will have access to it, and you will have access to it. So if you have a question that you're not sure about, go to the hint sheet first, because it's probably on there, and if not, I'm happy to answer. So like for instance, do you use a first name, a Mr. Jones? Do you use initials? And we've kind of talked a little bit about this, and we think that we should be consistent in the guidance with that. I think we decided on initials, and they can make up initials or whatever, but just initials.
What about site?
So there should be no identification of site, city, should just be, generic, inpatient rehabilitation hospital. Yeah. All right.
Did you give us the website for the Writing Center?
I did not. But that I'll put a link to that in Canvas. So go ahead and go to the modules, and there's a Writing Center section, and I'll put the link specifically to that. And we're still figuring out with Drew exactly how the students are going to sign up, but it'll be an online sign up somehow.
So we don't have to. I mean, if we want to look at some of these documents.
No. So those are all posted separately. Okay. So any questions before we move forward with Wendy?
Just one really quick, because it says working with Writing Center and instructional referral. So do we have to, for them to book hours if they want to sit with someone, do we have to say yes?
So we don't have to,
Okay.
but I encourage you to do so that we don't get in the business of editing.
But they can still make that appointment. They don't
can-
need to have like prior.
Yeah, but I think we do have a risk of, I can tell you 3 students that will be the first ones to sign up, and none of the 3 of them really need it that much. So they really seek a lot of feedback, which is great, except for if we have a limited number of hours, we're going to have to cap that. And I don't know, I'm supposed to have a phone call with Drew to kind of figure out how to explain that to the students, and also have some very concrete way to stop it if we see all the strong
The
people.
Writing Center just write nice job exclamation.
There you go, Kyle. And we'll whatever we give to the students, we'll give to you as well. So whatever we say to them, we'll make a note. Okay. Anything else?
I'm just kind of, can you say big differences between what's on the S drive and what's on Canvas?
Yeah, so the only thing that's on the S drive that you need to access individually is the 27 documents for your students, right? That's why we didn't email them. So the ICF, the reference list, and the outline. those 3 things for all 21, 21 documents.
Okay. So all the work they've done prior to.
Yeah, because I was making Amy crazy trying to drag everything over, and I just got tired.
Right. So the S drive is a shared drive for you guys that don't have that. So I have a jump drive for anybody that doesn't have theirs yet, for people that don't have S drive access. Okay. All right. So he's doing okay?
Hey, guys, good? I sent him all the documents. He didn't have them, and he can't see the screen.
This is Louie. Louie is 16. He's nothing. And that's just such it's my screensaver. It just
Who
pops
gets
up.
totally bugged by my 4-year-old dog.
But it's the calmest thing you'll ever see.
Kiko, who's now a 4-year-old lab, loves Louie, and Louie is not a fan.
Okay. All right, you're good? All right, well, I am very excited to introduce you to Wendy Madagowski. She is, Wendy wears a lot of hats, and how I know her best, and Denise knows her as well, is she is the course director of IPED. So if you think we have challenges, you got to be very, very nice to Wendy, because she takes all the challenges from the 750 students and they go to her. And so she also has been a great mentor to me to figuring out how to get into this IPE. And what I've learned through working with Wendy is she's really good at facilitating groups and dynamics and that sort of thing. And that's why I asked her to come and help us figure out how we could be better facilitators for these small groups. And I had the pleasure of being in her small group facilitation class she does for the Academy of Medical Educators. And I learned a lot about how to just manage the room better, so I hope you all will as well. And so to prepare for Wendy, just so you know, we have one person on Zoom, and Guy will get you turned around. And so it may be helpful, Wendy, if you want to kind of know who's in here. But before we get there, let me just tell everybody what documents you will need for Wendy's portion of this. Are right here. So you don't want me to do anything yet? Okay. Okay, so I'll let you run the show.
Also knowing that she's from the School of Medicine and
Yes.
is an MD by background.
Yes.
Can I give Wendy 2 comments that were positive in my focus groups from graduates yesterday? Because I don't think that you get necessarily a lot of positive
Let's
about
hear it.
IPEs. And I had, the group said that they know there were situations in the clinic that were easier for them because of their experience in IPE, and that they 2 people in particular said they felt like they could communicate better with the physicians because of their IPE experience, they didn't have as much fear, trepidation, whatever about that. So I just thought that was great.
Yeah, we're in the business of delayed gratification.
We're in that J curve, and we're just starting to come up.
So, thank you. It's a very generous welcome, and I would actually like to get to know some of your names a little bit better. I recognize some faces, and one of my other hats is that I direct the Foundation of Doctoring Curriculum for the School of Medicine, and I know at least some of you have helped with our musculoskeletal teaching sessions with the students in the past. So, so thank you for that. And so what I thought, just you all obviously know each other, so this is really just for my benefit. So thank you in advance. I was just curious if you could just tell me your names, and I think most of you are going to be on this.
All of them should be on there.
So don't mind me just jotting some things down, but who you are, and then also whether you've done this content before in another structure, right? This has
The
been-
PCS3.
Okay, so that PCS3. So let me know if that's been something you've been a part of, as well as whether, and then just say a word perhaps about your small group facilitation experiences. I imagine it's a part of your curriculum, so it'd be good to just get a general snapshot of how much a part of your work is that. So again, you are, whether you've been involved in this course in this previous format, and then also your experience as a facilitator in small groups.
That's what Denise, you know,
Yep.
and so yes, I'm involved in IPD small groups. Yes, I've done this
previous course for years, and a lot of small group work in the site course.
Catherine Doty. I have not been involved in PCS previously. I'm new to the faculty in a small role here, also from background. But I have done, I suppose, a handful of small group facilitation feedback sessions after clinical education with students. I'm Chelsea Van Dyson. I've only done PCS as a student. I haven't been in facilitation experience.
And she did ethics or IPE as a student.
Trial
I'm Megan Bond. I've helped with the PCS courses and did ethics, I guess, as a student here. And then I've helped in like small groups within the neuro track.
There's Dan Miller, and I do a lot of the pediatric content and have worked in PCS3 consistently and have also done some small group, like kind of in lab settings and some in class, and then neuro courses.
I'm Carrie Leanne. I'm new to this whole process of PCS or Capstone, and I'm mostly a clinician. So a little bit, I'd say, like peer-to-peer with students from time to time, but not a huge part of my day.
I'm Dana Judd, and I have been part of PCS previously for several years, and I would say I haven't done a whole lot of small group facilitation, mostly big group teaching since I've been. You know me. I've done TBL with you and IPE, and also the small group things we do in neuro.
You Jim and have him share.
He can't. It's his side, not mine.
Okay, so my side.
So I'll get him to type to me while you.
Yeah, that sounds good. So my name is Tammy Strussel, and I'm the co-facilitator of this course coordinator. And for the last 12 years, a large portion of my work has been in the PCS process, 1, 2, and 3, and I have had anywhere from probably 8 to 14 students a year individually going through that process. And as far as small group facilitation, a little bit through like labs and small group activities in my classes and that kind of thing, but I'd say pretty limited.
I have Guy. Can I?
Yeah.
Okay. Guy Left is here. He is a grad of our program, similar to Chelsea, Kyle, and Megan. And he is an outpatient PT supervisor at UCH and has been a clinical instructor to 2 PCS courses. And Guy, have you done any
PCS1?
PCS? Oh, okay, PCS1. Sorry. And have you done any small group stuff? He hasn't said. Yeah.
A lot of these students who are students in small groups.
True.
Only in the PCS.
Okay.
I'm Toby Kinney. I was just involved this past year with PCS3. I was in an entry-level program involving problem-based learning, so like small group tutorials, and I taught in that program after. But then I went to a more traditional lecture-based program that I taught for 5 years there. So that's a small group.
I'm Michael Body. I've taught in past PCS3 courses in terms of small group. At prior university, I did some PBL type facilitation in classes, and then
So Dan Malone, been involved in PCS for a while now, I guess 4 years, 5 years, 4 years. With regards to small group facilitation, mostly just flying by the seat of my pants and lecturing labs, so I can't say I've had specific instruction or techniques, but looking forward to it.
Kyle Ridgway. I've been involved with PCS as a student and instructor in all 1, 2, and 3 on PCS as an instructor. And then as far as small group stuff, besides my experience with students, nothing with students specifically, but I do a daily round with physical therapists in the hospitals, colleague, things of those students.
Excellent. So I think what would be helpful for me, because it sounds like we have a nice mix in the room of people that have had a lot of experience with small groups, have had some real-time experience, and participatory experience. And it would be helpful, I think, to just also articulate what are the main things that you're hoping at this point, not knowing at all what we're planning to cover, but what you're hoping to get out of this. So, so I'd like actually a little bit of help with using the whiteboard.
I don't have a marker, so can I? Oh, you have some? Okay. We carry our own. We love you, Mike. Wow. And one thing I just want to tell you is because there's too modest, is both Mike and Dana have herded the students through the clinical reasoning, and this is the capstone of that. So they are very vested to see if their fruit is going to bear.
Or whether it's going to be rotten.
And bear with me, I think one of the things that's important for this, for our time together, is actually to be as explicit as possible about small groups. So we are right now a little bit larger than a small group. We're not really a small group. We're, I would say, a mid-sized group.
What defines a small group?
So a very good question. So a small group would generally be considered anywhere between 4 to about 12 at max, but about 8 to 10 is probably where you want to be. But I think a lot of our processes, well, maybe not in your program, but in a lot of our processes, we're finding that we're pushing the edge of that, and the techniques don't always work quite as well. But this is in contrast to a larger setting where you might be lecturing or even facilitating student interaction within a large group setting, and definitely different than the one-on-one clinical or bedside kind of teaching. So it's in this middle ground.
So just so you know, the groups that they will be facilitating will be 7.
Yep. So that fits exactly. So otherwise I'd switch to a different topic, right? So, but one of the things that's important to do in a small group is to try to use techniques to remain interactive. And one thing is actually to put your participants to work. So I know Amy, and thankfully you had some markers. So it's, it is actually, that's a pretty special characteristic of a small group facilitator that brings their own markers. But having somebody in the group actually get up, make use of the whiteboard or a those large post-it flip chart type things is something as a facilitator that you can always have in your back pocket. You always want to be a little bit careful about who you choose. It's not just perhaps the non-participatory learner who gets the task of writing everything, but it is one way to keep things moving. So anyway, so I'm going to do a little bit of like, why are we doing this commentary as we go along. So Amy, thank you for helping out here. And so I don't think we necessarily have to go around in a circle again, which is actually a term called group round, if you want to know that info. So let's just go ahead and one by one, in whatever order you would like, mention some of the things that you would like to get out of our time together. So what are some of your expectations or things that you would like to learn for today?
Well, to approach the peer-to-peer group, as well as the group of 7 when they come back together, how to not be intimidating when we're coming upon them and listening to what they're doing with each other.
Because we're going to be managing peer feedback time, but yet you want to not just ignore what's happening in that part.
How to encourage the non-participatory students.
And then the contradiction, how to make sure that someone doesn't take over run.
I just wonder if in peer-to-peer interactions, it's always safer and a really pleasant thing to highlight the positive. But how do you facilitate, not the negative, the critique, not criticism, the critique, and how to really engage that conversation, that kind of thing.
I was going to say something along the same lines, but maybe as well as at a deeper level, because sometimes that critique might be very superficial, or that's a tendency for us to be next to each other, especially as physical therapists.
very nice to each other. We're a nice group.
Except for this guy.
So I think another one for this particular faculty, not everyone here has had a chance to participate in this, but now that we have begun to integrate motivational interviewing within the curriculum, this particular group of students will have had some work on motivational interviewing, but how when we are addressing the students or the groups to be asking more and not telling everything.
Maybe so that's a good technique in general, and so maybe to refine a little bit would be to say, when is that most important in your group process? Like when should you really be keen in as a facilitator? Okay, now's my time to ask more.
And how, use some techniques on
Okay,
how to read
great.
language. And then how to, if you have a big mismatch in your skill set or performance, how to make sure that the lower performing people in the group are kind of nudged along and making their progress without making someone who's maybe a top performer really excel and feel like they're being pushed out of the conversation, help that out and kind of bridge the gap between those two. Again, performance or insight levels at a certain time.
So balancing learners at different levels,
Yeah.
making sure that each of them have something that's helping them move forward.
Yeah.
Okay. I think that's a good list. Is there anything else to add to it?
Last thing for me would be how to create constraints or bounds on discussion without driving. It goes to the ask and tell thing, but to kind of make sure things are on top of, but there is some organic kind of digression and discussion that is still fruitful without, doing what I usually do, which is to be really far off the reservation. Find your way back.
Kind of structuring the discussion to that hit Kyle.
Yeah, and kind of put, the arms around it without like suffocating them, like, that's on top of it, keep stirring it back.
Good. And that last piece actually reminds me of something that is also, I think, an important piece to small groups, which is actually spending a little bit of time at the beginning, setting the stage, doing introductions as much as they're needed in the context of the group that you're in. And then also setting ground rules. We'll talk a little bit more about that as it goes, but I think there is a natural tendency to jump right in to the first assignment, and you have a lot of work to do each of these weeks. There's a fair amount to get through, but it is important to spend some time in advance, knowing for yourself what you're going to do with the structure, and then helping to communicate that to the learners too.
And some of that is, we have a session, a 2-hour session without all these other people that are going to be, Amy and I, and the plan is to kind of set the ground rules and help them understand the process. So they're not going to be privy to that. So we need to make sure that we adequately communicate that to everybody else, because they're actually going to be in small group rooms, separate from each other and separate from us once things start rolling.
Yeah. And that gets to, one of the potential downsides to small groups is that people can go rogue, meaning us as facilitators. And we put the two rogues together, so hopefully you'll bring each other together. And so having a structure, having structure both for the students and for you as facilitator that you have to get through helps with that. But it's one of the, there's both the potential to go much deeper and meet individual student needs much better in a smaller format, because you can assess that and you can respond to that. But the downside is that you can have some inconsistency across the group. So I applaud your structure, and I think that you'll discover if there are pieces that need more or less, and as you go along. But you're starting out with much more than just go work on the papers together, which is would really end up with a really diverse experience for your learners. So I'm going to make one more comment, and then I think we're going to jump into a case that has been adapted to setting. And that is that
within that idea of ground rules, I think it's important to make a couple of statements about, like, this is a safe environment for us to give feedback to each other. This is the point of what we're trying to do, you know. And I would say for our purposes today too, we've got people with various experiences in small groups. And so I want you to ask the question, like, what the heck is a small group? What is I want you to ask those questions. And so I want you to feel comfortable with, you know, it's a safe environment, and that no question is too basic or frankly too complex. So we can go with that. So I would say, you know, speak up. It's okay. Certainly interrupt even. We want to get our questions answered in the moment. That's when they're in their heads. And I also would like to encourage all of you to feel comfortable with redirection. So if we need that, I think that would be useful. We don't want to start talking about large group structures or something else that's not really getting us to our goals for today. I'm going to pay attention to these too. So I would say this is what we want to do. And I also think the last thing is maybe have a little bit of fun. We are using a case that I hope will give us a chance to go through a lot of these questions to prompt the discussion. And if need be, there's a lot of different techniques that I think we can play with. But I think our discussion is probably going to be the most rich experience and sharing amongst each other. Okay. All right, so let's go ahead and pass up this case. This case is a case that originally was posted to a structure called MedEd Portal. I don't know if you all are familiar with what's on there. Yeah, and it's a online repository of medical education materials. And this case was developed to bring forward common issues in small groups. And the way that it's originally developed is that there's different pages, and so we're going to go through each page. And if you were in a small group with learners, you would give them only one page at a time. But just for copying purposes, they're all connected here. But please don't read ahead, because that will disrupt what we're going through together collectively, and I think we'll have quite as rich a discussion. So what we're going to do is go through each page sequentially, and I'd like to have somebody in the group here volunteer for every page just to read it out loud, so that we're all on the same page at the same time, so to speak. And that's another technique of involving people in the group. You should never be the person reading it out. You should always engage your learners in doing that. There are people that read fast, people that read slow, people that skip around, people that underline, people, you know. But you're going to have materials, and so if you do have things that you want to go over together, perhaps maybe it's some of the rubric stuff on the first day, you'd want to have everybody's attention on the same place. And so having a learner participate in reading something or describing something while everyone pays attention is a good way to focus the attention. Okay. So anybody like to start with page 1 here?
I'll start.
Oh, and just as a note, so this came from MedEd Portal, but Amy did some tremendous work in adapting to your current setting.
And Tammy told me what the common pitfalls will be. Okay. So the case of Dr. Novel. You are Dr. Sage and have been contacted by a mentee from a few years back. Dr. Novel, he is teaching his first Capstone clinical reasoning class. He tells you all about his experiences. So day 2. Dr. Novel approaches the classroom at 1:45, 15 minutes before his discussion section is due to start, as he wanted to leave plenty of time to get himself settled and have the room set up for the peer assessment discussion. He's reviewed the examination section, made a list of questions, and developed a few talking points for the group. He feels completely prepared to teach this 3rd-year DPT course, but still his stomach is somewhat unsettled. Dr. Novel takes a deep breath. The students start trickling in. You'll note none of these are our students. There was a reason for that. Okay. So first Amy and then Bella. He is able to find them quickly on the list. And then right before, I missed this one up, right before 2, 5 more students walk in. Hi, I'm Cameron, Harry, Edward, Frank, Itzak. He introduces himself, reminds the group that they are to provide peer feedback on the draft examination section of the individual case report, and 1 to 2 members read before class. And so he says, okay, break into your assigned dyads or triads, which were on Canvas. Begin providing feedback based on your rubric. As this is the session in the Capstone course, he has been impressed with the group's interactions, initiative, and work products thus far. However, he notes Amy and Bella are both silently reading each other's drafts instead of providing feedback. Cameron and Harry are talking about the Avs game. He inwardly groans, it's going to be a long day.
All right, so
No one
what,
wants to talk about the ads.
Whatever, y'all, move on. Rocky, fine.
This was obviously.
It was Amy's lack of sports caring.
okay, so what are some of the things that, your eyes are probably, or your ears probably went right to some of the student concerns. But before we get to that, what are some of the things that Dr. Novel was actually doing well here? So think about that for a second.
You got there early.
Yeah.
Trying to coordinate names with the class roster.
He's prepared. He's got a list of questions. He's reviewed things.
I mean, frankly, sometimes that doesn't happen, right?
Yeah, that's reality. Yeah.
Orienting people to the goal and focus.
And what are some of the things that you're noticing that are happening in the session that seem to be concerning you?
Each group is sort of doing their own thing, which most of the time is not focusing on what they're supposed to be doing.
And so be a little more specific about that, say more.
Well, they're not, none or any of the groups. So the 2 groups, Amy, Bella, and Cameron and Harry, are not following the structure of the class that you set up, or the group.
So, and Cameron and Harry are
Completely up to us.
right. And then what's not quite right about Amy and Bella?
There's no interaction.
So they didn't come prepared.
They're not prepared.
I actually should already read.
They're supposed to have done that on Monday, and they're supposed to give peer feedback on Wednesday. So they're not ready.
Okay. And what are some of your initial thoughts about, as a facilitator of this group, you're seeing this happen? What do you do first? What are your first steps?
It seems like there's a complete, like, is this supposed to be the first session essentially?
No.
Third,
No, it's examination.
Okay,
They've done it.
So they've already,
Second.
okay. Well, so then you wonder what happened in the first couple, because there seems to be like a lack of expectations and ground rules and, just, so you think that would have already been established?
A little loose.
It's a little
this
loose.
time.
It's a little loose.
He's been impressed though, so who knows what happens. Sessions.
So I might be inclined to find myself going to the pair and sitting down and just asking questions about how it's going. My observations are that there's a lot of dialogue, so I just want to make sure that I understand, that you understand what's supposed to be going on for that group, for those 2, and maybe go and sit down with the other group and just finding out, it appears as though you're finished, either finished or didn't know quite everything you needed to do, but you tell me how things are going and how you want to proceed.
I would be, I'd be inclined to go to the group that's off topic, the group that's reading, just to kind of get them on track. And if the sense is that the other people are prepared, actually give them some time to get some material, actually be pseudo prepared before having to engage. If the assumption is that they're not prepared.
Yeah, and I think that I probably would think that they are a reasonable pair, that they probably did hear Tammy Maine's instructions, and wanting to find out, what doesn't seem to be going right, asking them more questions again.
I'm sorry. Go ahead. You go.
I was just gonna say, just in the perspective of facilitating the group, so this person is prepared. He already had some questions that he's probably hoping that they're discussing, but maybe is able to use as a redirect or to come back in instead of, hey, why are you talking about the Rockies game, Cavs game, whatever it is, of sort of jumping in that way might be something that I would consider of, hey, can you explain this more to me, or I noticed this when I read through. What do you two think about that? Is that too direct?
Well, I think that'll work. But let's talk just a second about indirect things. So when you're in a room, it's always important to think about how you arrange the room. And so that's part of the idea of coming in advance. You really want people to be sitting and giving feedback, maybe even, set up some of the chairs so that they are actually in dyads like that when you're about to go in. So because then otherwise you end up with everybody in their regular spaces, so you may want to orchestrate some of that as a start.
Especially in those rooms.
I was thinking about those rooms because aren't they like a table? It's really hard to actually structure.
Square table.
Like it's all going to be a large
it is.
group.
The
They're all
No,
talking from.
I think you can move the table.
At one of the first level small rooms, so like 1100 one, 1100
So
two.
there's the multi-purpose classrooms.
Yeah.
So they have big tables like this in them. They might be all together in a big square. So you may want to bring them apart or push them to the side, and so that's something that I think can help.
And Wendy, can I add one part of, so one of the things that we haven't sent yet is I've made their dyads and their triads for you all. You don't have to do that. And part of the reason, so like weeks 1 through 3 are certain people are together. So, and they will know that because then that will help with what they review. So they'll already know that I'm supposed to have reviewed Dan's and Kyle's when I come in. And so they should then go in that group themselves. Does that make sense? So that, and we'll send that to you. I just finished that this morning. So, and that'll help.
I've figured that out.
Yeah. Maybe not. Maybe not, Wendy. Yep, you're right.
We'll figure out who's they've read.
Yeah.
But they might not have figured out that they should sit next to each
Yeah,
other.
good point.
So you may need to prompt that. And the other thing, say you all are talking about whatever the Rockies, whomever. There's something very powerful about just sort of wandering over and kind of hovering over people, because laptops can go away. The assignment can appear, and so don't forget to use your own body as part of your facilitation. It really can be helpful, and I think it's up to you in terms of your comfort level with people. But sometimes a hand on the shoulder, I think that's an okay thing. It's sort of, people have different perspectives around that, but sometimes just wandering around, because you're going to have multiple groups working together. So you're not always going to be able to, you kind of want to avoid doing, that's probably not going to work too well. But it's up to you. It depends on what you need to sit in. You might set a standard of that. You have as part of your ground rules. I'm gonna sneak over and listen to what kind of feedback that you all are giving each other, because I don't want to interrupt you, but I want to really get a sense of the hard work you're doing in this. It's not easy to give feedback sometimes, and I want to really kind of know where you are so I can help you as your facilitator. So setting that expectation can help.
So I'm just thinking about the first session and where we're setting broader expectations, and I do think that that's an appropriate point. It might be an additional point later for the small groups to talk about, but do we just say, the instructors are going to kind of be eavesdropping. They're going to be trying to listen in so that they can make sure that everything is on track, or if there's things that they want to bring up. So I think that we could probably talk about that on the first day. We also don't want them to start asking us questions. So I think that's the other struggle when you are right kind of close by, that they're going to start saying, well, Bob didn't know anything about this test and measure. What do you think about it?
And I think that is going to probably be the biggest struggle of this structure, is that you are really trying to
encourage peer feedback, but the level of peer feedback is going to be variable, and it's probably going to hopefully improve over time. And so you are going to have to restrain yourselves from jumping in and commenting on the clinical pieces or on the writing, and set the stage so that you listen in, so you have a sense of what's going on, but you wait until you get to the large group reflective discussion part that happens after the peer feedback. And so that's why I would actually suggest the lurking approach, perhaps, instead of the scooting in with a chair, to really kind of be a part, because then you have, oh, you're here. I got to turn we got to welcome you into our group. Sorry, that's that would be a respectful thing to do. And then all of a sudden you're part of the conversation, and that's not what you want to be doing during the feedback part, as I understand it. Yes.
And so one of the things I did learn from TBL is when students would do that is there's a very intentional thing you do in TBL, which I don't know that we need to do that. Team-based learning, I'm sorry, which is what we do for the interprofessional course. And one of the things that I learned from Wendy and others is then you just go, well, Tammy, what do you think about that? When they do that question to me, then I just go back to the other, redirect it to just their exact question. Okay, Chelsea, what do you think about that? Help her out here. So, I mean, but we do a little different thing in the larger group, but I don't think that fits here. Where we turn away.
Well, I think
we do. We turn away.
So, and just to explain what that is. It's so if you have to say, Denise, say the two of you all have just had this marvelous conversation, and you're sharing something from that conversation with the whole group. And I sort of prompt you to share that because I've been lurking, and I'm like, you guys had something great to say about, how to get the specifics. I'm not coming up with a great thing with your assignment. Sorry. So why don't you go ahead and share that? And then you break eye contact. Mm-hmm. And it's slightly awkward for the learners for the minute, but you're breaking eye contact. It's awkward for you, but you're saying, I can make it through, right? Because now what's happening is that they are talking to their peers and not me. And by the time you get over here, they're like talking to each other and sharing that information, not just reporting out to you as an individual. So there may be a role of that. It feels completely awkward. And the students initially are like, they don't know where to look. But then very quickly they find their peers, and then it helps to perpetuate the sharing of information across each other.
So the other scenarios, I saw two different scenarios. One is just the walking around and listening versus actually observing something going on that you want to potentially change.
Intervene. So I suggested that maybe the body or the movement can help to intervene. But if not, time isn't ticking. They only have so much time to do the feedback. So what do you actually say? What words would you use to the people talking about the Rockies?
They say, ask them, so what did you guys think about what you read, or what did you think of this person's whatever section they were supposed to be reviewing?
Just cut right down to
what was the grade?
Answer your questions.
See, I'm
Maybe a little too
sofa first.
Trying to find out.
I know what Dan does. He's going to actually talk about the game for a minute. He's going to redirect afterwards, which is not a bad strategy.
Especially if they were playing the Phillies.
Yeah, and that's not a bad strategy. To kind of come in.
Or I might accuse Denise, my former teacher. I might. But you might say, well, was this helpful for you guys? Did you feel like this time was helpful for you of getting that feedback or not?
If it perpetuates, but would that make sense really early? Like if they don't seem to be redirecting at all, then I think that's like a little guilt trippy. Which might be appropriate 15 minutes into them talking about the Rockies.
Yeah.
My sense would be to ask one person a question about the other person's paper, or something that I had seen or wanted to discuss even myself. Ask that person a question about that person's assignment.
You go right to the redirect.
Yeah.
Is whatever you.
Yeah. So that both of them are engaged with his paper, and I'd asked her.
See, I can't pretend that something wasn't going on. I can't pretend that wasn't going on. Especially if it's session 3 and I've seen it before. So if it's something consistent, then I can't kind of distract them without sort of telling them what it is I'm seeing or observing.
Usually 3 strikes are out.
With Denise, there's never 3 strikes and you're out. Well, let's try. Yeah, you're still laying them down on the couch. Okay.
Well, I think everyone does have their own style, and that is fine. But I'd encourage you to think about trying something a little different. Maybe if you're the person that normally would be like, so, what do you think? What are your sorry, I'm not coming up with it right now. What are your polished comments for each other? Did you have any similarities in your polished comments? I don't know, whatever. So you could go right to redirecting them, and they're like, abs, polish. Or you could say something like, sounds like you both enjoyed talking about the game. How about we get back to our task right now, which is to get each other feedback on what we read ahead of time. Should have been done. So there's that range that you can try a little bit of affirmation or questioning, or enjoying the conversation, and redirection. So,
and Wendy,
yes.
From past problem-based learning activities I've done before, I found that, and I'd be curious on your thoughts on this, is that part of the lead off of the session, I never just be like, okay, get into your groups and let's go for the day. I think a lot of it's what do you guys think worked really well about some of your feedback from last time? So then you get sharing across your groups about the strategies that are working well for them. What types of feedback do you find were most helpful to you? And so then they start to generate those ideas, and already they're starting to think about how they can enhance the quality of their feedback, and then everyone's learning from each other in that process, and then you move into these activities. So I think that there's ground rules that can be created from the group, kind of organically, first of all, and then the evaluation of those ground rules and the progress to date to help kind of center and focus and say, okay, let's do some really solid work. Let's all do this really good learning session.
So then you continue to reorient it to the goal always, but then you're also dynamically kind of giving actually actionable tips and discussing across groups.
Well, we're not giving, they're generating.
As well as they're creating their own goals as they go along. You can help to refine those goals as you see fit, but it's because they've created them themselves. It's just like a patient.
It's not just the goals, but it's also understanding the concepts that they're learning. So because you want them to not only come up with a good product at the end, but you want them to actually appreciate feedback mechanisms, have some skill and experience in providing feedback and receiving feedback and incorporating feedback, and actually going to the conceptual level of what kind of feedback is working well, what was most useful to me, helps them assimilate those concepts about either peer feedback or improvement, rewrites. There's a lot of things in this capstone that are conceptual things that you want them to take forward. So I agree.
I just would want to, I'd like to reaffirm that statement you made, and I think Amy probably can feel this too, having done the IPE, is that the hardest thing will be to not be answering their questions when they're looking at you as you're walking around. And actually, the way this was described in here, that he did all the right things in coming prepared, but he also came prepared to teach, as opposed to came prepared to facilitate. We can make that edit.
I do want to ask one more thing on this page, and then I think we should move on. We didn't really talk about what to do about the students that are not prepared. It's session 3. They didn't read ahead of time. And so what do you do in the moment with that?
I like to open up Canvas gradebook and just start putting in zeros. I talk to them about their remediation plan, and then I send them to Canvas.
I have to say that I wouldn't want to assume that they aren't prepared until I find that out.
Yes.
Yep.
Yes.
That they're not talking to each other.
It could be reviewing their notes. They want to refresh because they read it on Monday and they want to refresh really quick.
But if they haven't prepared,
Yeah.
if that's the truth,
Yeah.
then I guess you have to provide the time for them to at least do it so they can engage in the discussion. If not, they're going to be 10 steps behind.
Yeah, that's one of the things that I thought of when yes, they didn't prepare, but they're doing it now. And what can you salvage out of this session for them to actually be able to participate in when the group of 7 gets back together? If you say something at that moment, you might get less constructive work out of them during that session, and maybe you need to wait and say something later so that you don't lose that time.
I just thought of something that I could totally see happening. The bigger issue is what if one person's prepared and the other one's not?
Yeah.
And it's dragging down someone that's not. That would be maybe a worse issue than this potential case.
Yeah.
And this issue, I'd be inclined to give them like a time. I don't even know if wanting to just take 5 minutes and then start discussing students, but burn a whole time just getting caught up to read, and then it's like you're becoming a big group and got a chance to
Give them a timeline.
yeah.
Yeah, and do we swap out members of groups? If you have 2 people that are not prepared and they're sitting there reading a case, and you have 2 people that are like, waiting to give feedback, I guess you can't swap because they wouldn't have different same
I
case.
think you're stuck with that, and then, but I guess I'd encourage you to have some action and not wait too long, and having a conversation at the end of the session. I think you'll gauge whether they got as far in their feedback, and the hardest part is if they actually were able to read it and still give good feedback, and so there was like no harm done.
Yeah.
Like it felt like no harm done on their end. But it's still, I would encourage you to still provide feedback. And that's part of the idea of having the ground rules, which we didn't really incorporate this into. But if you say, our expectation is for everybody to read at the time. That's in here. But in order to have, to optimize our time together, to really make this as valuable as possible, that's what we want to be doing. And everybody commit to that. Now we know that there may be some things that happen or some problems, but let's be upfront about that. Let's communicate that if that is something that happens, and then we'll make sure to optimize. I do think that that maybe addressing the student that if you have that disconnect, once you're prepared, once you're just not, still having that conversation together. And if it's possible for the student to say, it would have been nice if you had read this in advance. That is so hard for peers sometimes for that to be the best feedback for the day, right? Yeah. But if you had read it in advance, I might have gotten a bit more from that. So, so helping to sort of build up and affirm the student that did the work, and also redirect or charge the student with being prepared the next time.
So how would you handle who gave feedback first? Because if I was prepared and Lisa wasn't prepared, and then she prepares during our session, does she give me feedback first so that if we don't have as much time, she doesn't give as much of my feedback, then I'm lacking the experience of giving the feedback?
What do you think?
That classic.
I know.
There's no way.
Okay,
Last minute.
Busted.
Outstanding.
You know what they say? Every good joke has a little bit of truth to it.
All right, Kyle.
I'm just glad she didn't say
I mean, one of the things I was thinking when you brought your point up, Chelsea, is could I, again, give a timeline? Okay, so I wasn't prepared, Megan was. So, all right, Amy, so Megan, I want you to go ahead and look at what your plan's going to be. What are you thinking you want to do? What did you struggle with? I might give her a little kind of side assignment, and then give Amy 5 minutes to read and if it's a short section. I don't know if that's a good thing, but it's basically redirecting, still not making you blow time, but you have something to do, but then the other person knows that they're on the clock and they need to get something.
We're not going to know. They're going to sit down together. We're not going to know until they start.
But once I gauge that, if I have gauged that one's ready and one's not, then I mean, I'm thinking about having an alternative to give somebody something to do while we're in there. But it's only if I've determined that.
Yeah, because it seems like, there's going to be a big difference between the pairs that sit down together and start working together and are clearly prepared, and the pairs where one of them is prepared and one of them isn't. Like you're going to be able to sense that almost immediately.
So I guess something, and I don't know if this is directly related to this, or the capstone in general is, so laying out expectations is, I've heard that a couple times, which seems to be a really important thing. So, and then I think of this peer-to-peer, PBL, TBL, whatever. I've really never been a part of that as a student of a facility, and I'm assuming there's a learning curve for those involved in doing that. So, and I'm just looking at you guys. Is our group of students being prepared to be prepared?
Well,
and knowing all the expectations.
So,
you know what I'm saying?
so based on something that I did in my healthcare delivery class last year, they are more experienced in this than we are because they do it in IPE. And they came in, like we had PT and PTA students together, and the PT students just took the lead. Okay, so this is how you do this, and so it really they do. And now some, of course, are going to be better than others, but I think all of them have more experience in this than probably anybody but Amy and Denise.
That actually provides me a lot of comfort.
Yeah.
Well, and ICE. I mean, ICE is all about peer. I mean, that's helpful for the four of them giving feedback on clinical stuff.
And you guys had them do that formally in clinical reasoning in a little bit different format, so they are used to, in this context, doing feedback. And they did discussion groups in clinical reasoning 3, which you guys facilitated. So they have been doing that online. But are there times when it's very minimal at the last minute? Yes. So that's what we're talking about.
Clinical reasoning 2
they did some peer review as well.
Okay.
Before we move on, that I do think what most often naturally happens is the person that's prepared starts. So I think they end up getting their time, and then the other, and so you may not see it unless both of them are unprepared. They may kind of hide it and sort of protect each other a little bit.
Yeah.
But you can start to see if people get irritated by their peers not being ready.
So what happens if we get an email afterwards that says, you might not have noticed, but, John wasn't at all prepared for the class?
So I'm going to go ahead and just answer that just for the sake of time. I think that's great. That's a little gift to you as a facilitator that you can make use of, and you really have two choices. You could say, back on the student, is that something you shared with your peer? This is harder. That it would make it more difficult to do that first part of the peer feedback. Were you comfortable with mentioning that to your peer? And if they were not, asking, is that something you would like me to address? But ideally, you can empower them to have that kind of conversation. And then, but usually they're just reporting it, hoping that you take care of it. In which case, I think it is good to have that side conversation, not right in the middle of class. You're not like, you don't want to embarrass people in the group. So afterwards, send them, you can even send a message, say, I noticed, even if you didn't really notice, someone else clued you in. And it's true. You have enough sense that it's true. I noticed that you weren't as prepared as some of your peers were for the session. Again, our expectations are this. Can I count on you to be ready for next time?
I like it.
Yeah, that's good.
That's where closing the session is also, I think, good. You can have them self-generate goals for next time, and then I'd expect them to self-identify those behaviors personally and create action themselves. I mean, that's the type of learners we have, and I expect that to happen. A lot of times it does, especially in smaller groups. So like, I really blew it this week. My goal is to really do a great job next week, and then hold it to them and they've already made that goal for themselves. But I think it's harder when you get on students, because just in the CV, it's like the enforcer rather than the facilitator. Right. And so I try not to.
I mean, it's not a nice one. Like students getting to the point, I blew it, and I blew that one. So,
But we have plenty of time, so I like the idea of an open reeval, reassess each time, and closed session. I think it's really nice.
So who would like to read page 2 so we can get through that?
I will. The silence is broken by the door crashing open. Hi, Gary, comes a chorus of relieved voices. I owe you $5, he says, gesturing to one of the other young men. The avalanche lost by more than 2 goals. Dr. Novel was on his straight face. He's dying to hear more about the avalanche, but it wouldn't look right to ask about the score. Hi, Gary. You stayed. Working through the peer review on the examination section. Gary seems easily in his chair. Okay, Amy, I really couldn't follow your examination, and I can't believe you left out the PSFS. Bella, your assignment was good. No comments. For the next 20 minutes, Gary tells Amy why she should have used the PSFS for a patient who was sedated and intubated in the ICU.
I just wanted y'all to laugh.
Yeah. When Dr. Novel approaches, Gary asks if he can leave class early today because he needs to prepare for his presentation in health and wellness. Dr. Novel resolves to touch base with his mentor, Dr. Sage, to see how he can get his class back on track.
So if we pass the abs comment, okay, go right to the meat of this. What are some of the things that you're noticing that need to be addressed?
Tardiness.
Tardiness. So lack of commitment from Dan.
And disruption.
How are you determining the lack of commitment?
By being late, by not having much depth in his feedback, and by asking to leave early because of something else.
But we don't know if Gary had a car accident.
Absolutely.
So let's say they didn't have an accident, Denise, okay? They did not have an MBA on the
Just got a
way.
medical diagnosis. But I asked in part because the statement that you used was actually a judgment against the institution. And just like what we want the students to be doing, the feedback needs to be very precise about behaviors or specific observations. And it's always safer as a facilitator to give feedback when you go to what's objective in that regard. Say, I noticed that you came in late today and that you were talking about the abs game instead of getting right into your group. I also noticed that you gave very brief feedback to your peers. It wasn't using the format that we have for the course. I also noticed that you spent a lot of time talking about one particular area of feedback, and so there really wasn't a dialogue, and Amy and Bella didn't get a chance to give. But anyway, you keep on going here. But being very precise about what you noticed, what are the behaviors that you saw, and then something like, what's your take on this? Or am I reading that right? Giving an opportunity for some explanation. What would you do in those 20 minutes, though, if you could take that back?
The 20 minutes that Gary is
I'm sorry.
expressing.
If you didn't let it go, what would you do to not let that go the whole? Because you've been wandering around lurking, right? So you sort of figuring out this soapbox about.
I guess I would ask Gary if he could be more concise and providing his opinion, but also the other side of the story, we don't know why Amy chose not to, and there might be a very valid reason why that was not done. So she hasn't got a chance to rebut, if you will.
So that actually brings up, how much of his dialogue versus directed feedback, right? So if we want it to be more dialogue, we probably need to set them up to understand that, as opposed to you're just going to sit and just listen to whatever the other person says, even if it's 20 minutes of gobbledygook.
So we
Or I might just, I'm sorry, you go.
we both talk a lot, doesn't matter.
I'm not going to talk to you.
I don't believe that for a second. And I would have the inclination in order to kind of get Gary off of his diatribe, is to ask Amy a question. Like, well, why don't we get Amy's take on why she might use that about? I don't know if that would be my sense to kind of stop the action, as it were. But the thing that I always struggle with is how direct in these situations, or how kind of more just to kind of nudge in the right direction. I feel like I always go the wrong choice.
Are you all thinking that you will have a general sense of time that you would expect if the peer feedback to be given?
We gave some structure to that.
Yeah, so I would suggest thinking about relying on that. So if you're noticing that people are going off, you could be like, okay, everyone's got a half a minute left, then you gotta switch. You know, you can just sort of make an announcement to the whole class, and everyone's like, we're doing that, but then the people that aren't get the picture. So making use, that makes it a broader, keeping to the group timing expectations rather than me trying to insert myself as a facilitator to redirect to in the conversation. I think it sounds like there's really these two parts. There's this peer feedback part to manage, and then there's the conversation afterwards. And in the conversation afterwards, I think what you were saying about, let's hear from Amy what her thoughts are about that, and the breaking eye contact. Those are the kinds of things that.
And with 7 students, somebody's probably going to say something. I mean, when it's that blatant, it's not always going to be that blatant, but it seems like there might be an opportunity there that you just need to not say anything. And the group will take care of their own. Yeah.
There's a little thing I like to think about, which is the N of 1. So you have, which is sort of from a research standpoint, but that someone has their own personal experience and that's their N of 1 and they think it's what everybody else has. And so as a facilitator, it's very easy for you to try to answer to that. But again, the redirecting to the group can be remarkably helpful. So say Gary was talking about this in the rest of the group and you think it's totally wrong. You don't have to say, Gary, nope, you're wrong. You can say, well, what other people think in the group? Anybody have a different opinion about that? It's sort of leading and opening up the conversation. And then, okay, so Gary, what are you thinking now after we've had a little bit more conversation? If you're trying to redirect an individual student's thinking, using the group to do it, challenging the N of 1 is what not you, everybody else.
Wendy, I know this isn't TBL or team-based learning. Do you think that article that had the 12 tips on TBL, it has some of that in there? Do you think that would be helpful for this group? A few of those about redirecting, waiting a period of time, et cetera. Do you think that would be helpful for this group? Because I could send it.
Okay. It's pretty dense.
Yeah, but the bullets might be helpful for people to look at. Okay.
So how do you, I guess I'm just and I don't know if this is an unnecessary comment or not, but so what Gary did was really, he did give feedback. It was very direct and he just went on and on and on and on and on. But what we're really trying to do with peer-to-peer feedback is the word I like that's being used quite often is dialogue, which assumes a give and take. And I'm just wondering, with what's been going on in some of the smaller group discussions that we've had to date, have we ever had, our students, do they engage in dialogue, or do we, I can see a stronger student versus if they're in a dyad with someone who's on the quieter side, I can see this occurring. Is this a realized thing we need to be concerned about, or you know what I'm saying? Or
well, I have to say the experience that I've had in the psych courses when there's one-on-one, when they dialogue with each other, that the room is just full of chatter. I mean, they are just doing it because of the level of students they are and their commitment.
I don't doubt that.
Yeah. I don't know.
I do think we can have some, though. I do think, Dan, there's going to be some that may be a little bit challenged, like in the clinical impression. They're like, all of a sudden, Lisa starts pouting hers off, and it looks great. And I'm like, mine looks like, I'm not going to share. So I do think we could have some of that. So I think there may be times we need to help. And so I don't mean take over, but just, so what was, good about Lisa? So let's compare. And then what can you learn from that? Something like that. I do think we're going to have some down quiet times for a few people. As I made the groups, I'm like, that week's going to be maybe, that week, maybe not.
Would you advise that? And I guess, I'm just writing down key words and ground rules was a cool thing, and setting up expectations and dialogue. So I'm just writing down these key words. Is that something you think we should bring up, at least for the first few of these Wednesday sessions or something of that nature? Does that seem like it'd be a uniform thing we should probably do?
I would, and I would, like what Mike said, I would wrap up. Don't, just let them roll, because I think then you're going to learn a lot about the dynamics and what they saw from each other as well. But I think Timmy and I are still working on that Monday session, and some of these words we want to also put out there and let them know the first day.
Yeah, I can, say that about some of the things that are going to come up, like the clinical impression. We're not clear on clinical impression, so that might be one of the places where students do struggle with each other in terms of the content. Because I think examination, what test and measure to choose, is going to be easier than when they talk about a prognosis or a clinical impression.
And I would imagine that that's the time when the dialogue is going to be the most rich, so that the feedback's happened and you've sort of figured out that people aren't quite getting it. And you can facilitate a conversation of, so what are people noticing that they're struggling with? Or, are we getting as deep as we should here? What do you guys think? And, and really trying to foster that, finding, I call them themes, but finding sort of common issues across maybe, might help to deepen some of the feedback in the next steps. So people won't necessarily, if they have very parallel experiences and things are just chugging along just fine in the pair, they need to hear from another group that's challenged by something, because they're gonna learn from that too. So part of your job is to facilitate pulling those things out from the peer feedback, and having those conversations. And then sometimes you have to just have the conversations even if they haven't yet, because you've noticed when you're reading things, you've noticed, okay, we really got to talk about this issue. And they might sort of be at the superficial level, and you may not be able to get them to do it on their own, but you handle it together.
Can you hit on for a second though also Gary's behavior though? Because that's also something that has to be addressed, and just behavior coming in, disruptive, all that type of thing. And I think I would sense that the powerful thing would be that one of the expectations, one of the ground rules, is that everybody enforces and gives feedback on the expectation of the ground rules. Kind of like, there's some colleges now that have the student code that, if you see something against the student code, you are held responsible to take care of that, or else that's great in the code as well. In other words, the expectations of the group self-polices itself. Does that make sense? I mean, is that something we should explicitly outline, or should implicitly kind of? I think it's nice to give everyone ownership that, hey, if you see something or you need to, just like you're giving feedback here, same type of structure in a non-threatening way, you can give feedback to your peers if they're not performing, not giving good feedback, the way those type of things.
I think that's a good thing to do. Not every group is safe for that or ready for that developmentally. So I think you can gauge that. You have a lot of structure in the course, and I think it's okay to say, here's our expectations. You don't necessarily build them from ground zero. But I do like the idea of asking students, what works well for you in groups, in small groups? What do you enjoy about small groups? What helps you with your learning in small groups? And having that then turn into some of, and then they're going to say things like, well, prepared, and that can help perhaps to generate the list. And so it's self-generated, but you would probably insert some things too, because you have such a structure to the course. So we're out of time.
No, it's okay. We can go to 5. Are you okay?
When did this start downstairs?
At 5.
At 5.
Sorry, Wendy. I thought we were getting your pen. If you're okay.
Because I would really like to do page 3, and I feel like I've been cutting people off a little bit and taking a lot of the questions. But my plan at this point would be, because trying to get through some stuff, is that we go through page 3, and then we take a pause and go back to what we were thinking about. Because I think some of these topics are not going to be in the case, and we want to make sure to get to that. Okay? So who would like to read page 3, day 3?
I'll read it. Dr. Novel welcomes the group and explains that he is generally impressed with the evaluation and clinical impression draft submitted. The group seems to perk up a bit. Then he suggests that he asks the group what they thought of the last class. The group is silent. Do people have suggestions on how we can be more efficient in providing our peer feedback? Amy and Bella admit they did not have time to review each other's documents before class, but will make every effort to do this for the remainder of the class sessions. Cameron and Harry sheepishly say they were too focused on the avalanche loss and couldn't really concentrate. Overall, the room seems transformed, and Dr. Novel is encouraged. Finally, the small groups engage in the peer review process. As Dr. Novel sits back and lets the conversation swirl around him, he is pleased with the interaction and depth of the peer review. As the class is transitioning into the working session on the intervention section, Edward asked Dr. Novel if he can skip this part, promising to work on this on Friday. He doesn't have an elective and has the whole day to work on this section. As Dr. Novel is trying to determine how best to respond to Edward, he thinks, what would Dr. Sage do now? This actually brings up the fact that we have not made any sessions mandatory. The only ones that are optional are Friday. So they're mandatory in the way that every class is assumed that people are going to be there. But I think that because we have so much time dedicated and so many things that we really want to accomplish in both the Monday and the Wednesday session, I guess, Amy and I, in the very first day, we're going to need to have discussions about the importance of attendance.
But also, if you're a dyad or a triad,
You're
lack of
letting your
attendance is
person
harming
down.
your classmate.
Isn't that impacted?
This is
part
the
of
working
participation rate?
Yes.
But it's a relatively small, percentage. But I really think that the piece about the dyad, triad is, that's a huge deal. If your person's not there, you have 3 hours dedicated largely to working on this.
But I think part of the idea is that it would be like after the peer feedback.
Yeah.
And someone
He's
would
ready
skip
to
out
leave
early,
after.
so to speak.
In the more individual part of the,
Yeah.
that's the day.
Because that's part of your structure as well.
And one thing we did do, Wendy, that I don't know if I sent you, so for those of you that are looking, sorry, it's a document that looks like this. Because of one of your suggestions, Wendy, is that we gave a little more than just, okay, go start working. We then came back to a little bit of peer. Y'all didn't get that. That's part of the problem. Okay, so sorry. So we gave a little bit more structure, and I don't mean to take away. I just wanted you to know that Wendy pointed that point out, is what are you going to do when they decide to just go off and work on their own? So we tried to come up with some questions, and that's kind of what Wendy had mentioned, is some questions that will guide the big group to keep them engaged.
So the peer one-on-one, the group of 7, and then actually some dedicated time for them to work on incorporating what they've learned from the group into the section that they are working on. So that's the point at which some of them might say, I work better, in the library on my own. And I can't really argue with that. Some people do.
So I wanted to actually take a minute to have us think about what are our reactions to that. So think about what your personal sense is around that. Should they stay in the classroom? Is it okay for them to go someplace else? Is it okay for them to go someplace else just because they're a pretty good student, they're probably going to do it, and so that's all right, and maybe you can focus more on the student that needs help? So what is sort of your gut tell you?
When it's a working session and the person's expected to work and they are always distracted because this is like asking questions, copy and stuff, right? Then maybe they need to go work on independently.
I don't care if they go work independently. I'm probably more supportive of this adult to.
Yeah, I think I like the adult learning philosophy. I like also what are the expectations set by the lead faculty, and I try and be supportive of those expectations. And so that's some clarity I need to gain myself, so I can be as cohesive as possible with the other groups. But then I like asking. I've already read what their section is as well too, and I know how much work it's going to take. And then that's where, as well as you've heard the feedback and how extensive it may or may not have been for that section. And if it's if they have a ton of feedback and they've got a lot of work, that's where I might say, well, this is a really good time for you to make some headway. And I know you got a lot of great feedback there. You sure you don't want to work on it here? And then that way you can ask them questions or get some better clarification. You got a ways to go. It's due Friday. I know you want to work on it then, but then you're not going to have the support network here. Do you think that's your best strategy? Kind of
I think the support, because I think what we want to be also recognize is that we have all this faculty dedicated for this time, and if everybody just scatters, we're not taking advantage of the faculty's time. So maybe we can kind of approach it in that way, that this is dedicated time where this is the only time of the week that all your faculty is going to be together. So this is the time when if any questions come up or clarifications or whatever, that's why we want you to work in this group. But normally I'm all about go work wherever.
I like the idea that you assess the data that you have. So you've already reviewed it and you've listened to what's going on, and you can, to this reasonable student, say it looks as though this would be a good place for you to potentially work on it because you have lots of things that you need to work on and we're here for questions. Versus somebody else, but the data is, the
They're on
writing
top
is
of
good, everything looks really good. You know, if I could pick my kid up today and go home and work on this, and, you know, we would love to do that or whatever.
I think it's also the snowball effect.
Yeah.
Right, where yes, your person that really doesn't need the help is going to leave, but so are two other people that probably do need the help because you've said that's fine.
And I think to put out there, you're gonna be in a hallway and you'll start hearing other people leaving and the students are like, man, I can't leave. The course director, I can't leave. Everyone else is leaving, I wanna leave, you know.
So then I think you probably have to do the,
So
you have to make a
collectively,
decision.
you all have to.
Yeah, I think we have to be
Energy,
consistent.
yeah. Just like we should have a collective way of doing a clinical impression. We don't have that, we got all these people.
We started that 12 years ago.
And let's see how far we got.
I think we do need to come up with a decision on that, and then we'll make sure that you guys know what that is. Yeah,
I think we encourage.
Believe it or not, I will concede to a better argument.
Well, I think there's two things at play. I think we know it'll benefit them to stay because of the support network, but we have to respect them as adults and as individuals, and it's their decision. Like, my gut is always, well, of course you should stay. Look at all these people here. Or, this is your class time. You should just get it done.
Yeah.
But maybe that's not what that person wants for that day. So,
Well, and it also may be a
yeah.
exit student, and we've had students who don't do well in a room with 10 people
Yeah.
and really concentrate better when they're, you know, they're on their own.
Yeah.
So there could be extenuating circumstances.
Yes.
And maybe we can
However-
present it. The expectation is that you stay, and then, you know, but in an extremely rare instance, there might be a time where it would be okay for you to go, and please discuss that individually with the faculty member or something, so that you don't have the assumption being everybody is going to leave, or you hear everybody in the hallway, or.
And then maybe the option of using one of those little rooms in between.
Oh, the little
the
small room,
little
yeah.
rooms.
Mhm.
So you.
They could be
one goes
there
around
and
and
then-
come check on you periodically.
Yeah, those
It's
little
actually a
little
really good
rooms.
solution to the I work better on my own. We say, all right, so we have some additional rooms right outside here. So if you feel like you need a little bit of solitude, feel free to go and work in that room without
Support
a,
network right here.
right. I like that.
You guys don't run PBLs during the summer, right? So those rooms, okay.
And, you know, pay attention again to your room space, so like, and the energy level, frankly, but after you finish your peer and your general facilitation, and you're moving into this other structure, you could get people to move the tables around again. If you separate them out so people have a little bit of extra space, they can lay their papers or computers out. Excuse me. That might sort of symbolize and show the transition point.
There are enough of those rooms to have.
Amy's going to be in 3,500.
I'm in 3,500.
We have
Lots of rooms.
Lots of room up there. I can spread out. So, yeah, we actually have, I mean, if something happens where the small group rooms are not working for something, we actually have 3,500 for the whole semester in addition to these small group rooms. Yeah, it seems like it's the right size. Yeah.
Are you all interested in page 4 just to wrap it up? Okay. Who would like to read this?
At the next class, Dr. Novel tried to use techniques to bring Amy, she was not interactive last session, into the larger group discussion. We started by having Amy read aloud the next pages of the case, and is startled to find she has a strong, clear voice. It is not what he was expecting from a shy student. As she is reading, he sees Harry reach over to Edward's notes and start drawing a diagram, and the two of them start whispering. Rather than addressing this situation directly, Dr. Novel waits until Amy has stopped and then asks Harry to check the effectiveness of early intervention for patients with stroke in the ICU. He pushes the classroom's keyboard over to Harry's computer to see what he finds. However, Harry whips out his mobile phone and starts filling off the information. A quiet giggle is barely heard. Dr. Novel turns in the direction of the noise see this Cameron's head down, looking just below the edge of the table at his iPad. Harry then falls silent but continues to scroll on his phone. Dr. Novel feels the group dissolving before his eyes.
Patty's doing so good on page 4.
So, I think one of the things that is so strong with this curriculum that you're putting together is that you're starting with the dyad, so everyone is going to be talking. Not as well, sort of definitely, at least, but everybody's going to have a voice and participate. But when you transition to the group discussion, then you're going to have the potential for all the various scenarios. Someone, which we talked about a little bit, someone talking more than they should, someone who might be quiet or shy and not speaking up, as well as issues with technology and distraction, which is a little less likely to happen when you and I are just talking to each other, but when a group comes together, you can start having that. So this part of the case sort of brings all those pieces up. So let's actually, let's take them a little bit one at a time. So Amy, who wasn't particularly vocal in another session, was sort of tasked to do something. But, are you leading?
No, I'm going to stand up.
Okay, because I think you'll do this right at the moment, knowing you and our prior conversations here today. What are all the potential reasons for Amy to be quiet? Go.
She doesn't feel well. She doesn't feel like she has to handle all the material. Something has gone on in her personal life. She really would rather observe and listen and not be the talk.
She had an MBA on the way in.
Yeah.
I forgot.
So that's thinking about her. So now let's ask somebody else. Chelsea, what do you think about the group? What about the group might impact whether Amy is?
Could be a comfort level of prior interactions with people and how she was questioned before on part of her decisions. She was like, I don't want to be questioned again.
Read your paper.
Didn't have purpose, but maybe from a group perspective, maybe she's just done with their behavior too and is picking up on what's going on in the group and doesn't feel inclined to participate.
She's intimidated, she's an introvert.
On the flip side, maybe she doesn't feel the level of conversation that's engaging her. She's just silent.
Learning style is a big one. She may not be auditory, vocal, but has to process later.
Maybe she feels that she also knows more than the rest of the group. And I'm not getting much back from them because, I've got it. I don't really need this.
So we just came up with almost like this whole spectrum. Either she doesn't know enough because she's not prepared, or she knows more than the group, and so it's just letting them sort of figure out the basics, to having physical, emotional issues personally or in the family, to group dynamics. So like it's the whole gamut. And so I think I really like thinking this out loud with people because it helps to, as facilitators, to be reminded that we don't know. And what we do to handle it may or may not work because it really should depend upon what the situation is. If someone's having a bad day because they physically are in pain, then maybe it's okay to just let them be there. We actually in iPad had a situation where, did I tell you that? I talked about this student who was sitting back in their chair like this in their group. And then another time they were actually standing up against the wall and not even sitting with their group. And the group was like, what is with this? Like a team working on stuff. And they had significant back issues. We're seeing a therapist and we're in the middle of getting other treatments. And
and it took a little time to explain that maybe they should say something, they should reveal whatever degree they were comfortable with their peers, so that they actually, because the impression was they're not engaged, they don't want to participate. So anyway, it's important to find out what the issue is, or to sense out what the issues are. You can have individual conversations with people, you can watch it over time, lots of different ways of figuring it out. But it's important to gauge that before you decide what's the best way of doing it. An introvert is going to handle things differently than an introvert who's prepared is definitely different than someone who's not prepared. Okay, so that's the shy or sort of less engaged learner as perceived. And then there's, we talked a little bit about the overly talkative individual. I think it was Gary earlier, right? Because I think that was somebody's, did you cover that one well enough? Do you all have a sense of how you would address a student that's over talking their peers in the feedback part, or in the, let's hear from this side of the room.
Well, I was just thinking about that example was someone who was over talkative and didn't know what he was talking about. Because we have a number of really strong students that just, well, so I'm thinking of two in particular, and I guess because this is being recorded, I probably shouldn't use names, but one that talks a lot, has a lot to say, and is usually pretty spot on. And then one who talks a lot in the same class, who is rarely spot on and still continues to, you know, be used just over and over and over again. So I don't know if it, you know, both of them are a little challenging, because I think the one that really is spot on, sometimes you do have to just say, okay, we're going to go on to somebody else. The other one is, I, you know, sometimes just feel like it's a lost cause.
I do think, though, that we know our students. We have, it's not like this is the first time we're working with this small group. Most of us know them and and I think we do know how to do that. And some of us use humor in one way, and they know we're going to say that, or we just come back and say, okay, well, thanks. Now can we go back to this? I think that we have a little bit different relationship because it's not the first time. Yeah. And I think what I learned from some of the standardized patients is we have a little bit of capital with them. So there's a little bit more forgiveness if we do just say, okay, we need to move on. Mm-hmm. You want to broach the technology?
Yeah, I think that's a third thing in this, on this page, is the idea of people starting to use lots of different devices, and that sometimes can be distracting to the group. So kind of like we talked about before in terms of your sense of what to do with the students that want to leave, I think there's the tendency to have biases around this, either that you're okay with it or you're not okay with it. I think that's important to think about ahead of time as a facilitator. And then the question is, well, what do you do? And going back to setting expectations, sometimes that is something to actually address in the beginning. Now, I think there will be times when maybe you do get into a clinical question, in that when you're having that facilitated group time, and you do want to figure things out. So there is, I think, good reason to have resources, but it's a matter of figuring out how to manage that. So do people have some thoughts or experiences about how they've either struggled with this or been successful in managing technology in a small group setting, or even a large group setting?
Let's just think about having it be a group decision. Like, what do you guys feel about the use of technology here, and what are some ground rules we can try to set together, so that it comes from them? Like maybe they would say, you know, let's use it if we need to look something up. I mean, I would have it be a group decision.
So many of them read and write everything electronically that it's hard to say put them away. because they may not have printed off, their feedback or printed off, the other person's paper for discussion. So it's hard to definitively just say none, because so much of what we do is all.
Yeah, I think probably 90% of them are going to have it on the computer.
The question, I think this type of behavior comes up if they feel like they're not invested in what's being discussed, right? And so I think that's the fundamental underlying behavior, or they're distracted because of something going on in their life, like, hey, I'm checking on my kids, he's sick, something's going on in their life. And I think the tendency, it's not going to happen in the dyad to the triad, it's going to happen in the group discussion. So I haven't even read your section this week, and now you're presenting it, right? Because you do 5 minutes presentation and 5 minutes group discussion. And it's hard because part of me might even I might not process as well hearing you talk about it. This is not how I'm going to do it. So I might want to be reading it or doing something because and I wonder what your guys' thoughts are on when we go into the group, because that's where I see probably the tendency is going to be the hardest to kind of facilitate, especially when some of them don't have the level of knowledge you have or the smaller dyad as of this piece. So what your guys' thoughts are on that, or your thoughts on how to kind of handle that? So I think that's where you're going to see any issues are going to appear in that section of the actual class session or working session where you help.
I mean, one of the things, and I certainly will let whoever correct me, I was thinking for my group, because again, I'll be on my own, was thinking that if you're looking at this page 1, I'm thinking about week 3, where we've got Wednesday, and it says each individual describes their test and measures, their 2 top test and measures. I would, as a learner who needs to read it, I don't get it when you talk, is I would say and allow the group, let's read it. Access it, read it, briefly scan it so you have an idea of what Mike's talking about when he goes. That would be my thinking.
It'll be like a half page.
Yeah. So not a ton. So you should be able to scan. We could. If I can figure out
They're not all going to be half page. I mean, if it's test and measures, it's going to be largely a table. Yeah. So I think that'll be pretty straightforward. But the evaluation section, that's pretty big.
Okay.
So but they will have Canvas access to all of them, even if they're not in the same dyad or triad that week. So,
yeah. But even for me, if I can read and listen to you, I'm doing better than if I'm just listening. That's just my style. So I would say actually part of that could be the ground rules of just learning about how people do process, and that's something might be helpful for me to know the group from first day. Just some thoughts. I don't know.
Yeah, it's pretty obvious if someone's just.
Yeah.
I don't think people want to do that.
Yeah.
I was going to just mention about trying to curb some of those distractions. I mean, you can't eliminate all of them. So, hey, this is the breakdown of this small group. We have a time at the beginning to do the dyads, triads, but hey, maybe at 2:50. 5 minutes if you need to check your phone, and setting those rules right up front or checking the score of a avalanche sports or whatever you want to do, and then doing it again maybe an hour later. So, I mean, you're not going to take care of all the distractions, but at least try to set the parameters. I mean, you're in clinic walking around with the computer all the time, documenting. Don't do things that you wouldn't want your patients to see, like Facebooking and checking scores and whatnot. So that's kind of the ground rules I'd probably try to integrate into the discussion.
I think having the conversation in advance is probably ideal. And if you don't and you run into problems, it's okay to take a pause. I've definitely been in groups where I've been like, okay, time out. We are all over the place. But we got to get back focused, or wow, the energy's really low right now. Let's everyone just take 3 minutes, go run around outside, or what. It's okay to regroup, to pause and come back and have that conversation if you need to, midway if you didn't think you needed it in advance, and then it becomes apparent.
Especially in a 3-hour session.
Mm-hmm. Yeah.
I could see that.
I'm a part of a group that has just that we say no devices, but we have breaks, and then you can make a phone call, you can check your phone, whatever. And it sort of takes away the anxiety of not knowing when you're going to be able to get back to it. Mm-hmm. Those
a lot of schools are starting to be very connected to our devices, so.
But my understanding is it gets comfortable when we're talking about clinical reasoning and we're doing prognosis, impression, testing, they can be looking
At what they,
Was part of the, and I'll just ask, so is part of the, is one of the goals that the individual student can concisely and explain their point of why they chose? I mean, so I guess I'm speaking against the reading. Is it part of the exercise would be, I can put forth my case, I can present my case in such a manner that you don't need to read it.
Well, but a lot of them won't be able to, I mean, remember this, first of all, they're selecting students at an earlier time point, CE2. They don't have a lot of confidence in their patients. I think we're going to see that, less confidence in these than in PCS3. Should they be able to work through that? Yes, and I think that's the expectation, but that's one of the reasons they have the peers, is to help them to kind of work through that.
So I'm just looking back here, trying to see whether we got to some of our objectives. So this top one's approach, the peer-to-peer with 7 in the room, right? And not being intimidating while listening. I think we kind of talked that through about, I suggested you to lurk, which sounds intimidating, but nonetheless, that's part, I think we kind of got to that one. Encouraging the non-participatory or the over-talker. Facilitate constructive feedback and critique. To me, I thought some of your comments about going to, what worked for you, what was most helpful from the feedback. I think that really heightens that understanding of those concepts. But I think it's okay to then, once you've had some of those terms out there, saying, okay, have you heard what you just said? What are the specifics there? What are the behaviors that, and you have that little rubric that you're using that says you need to give specific examples and reference resources, and so you can point back to, this is, let's go to this level here. Let's get a little deeper here, a little bit more specific. I think those are some ways to help facilitate the feedback and to go deeper. Ask more and not tell. I think we talked about maybe the asking part is for sure in the, or even not even asking anything in the initial peer conversation, but going into the facilitated part, that is a good technique. That's the N of 1 as well. That fits in there. And then balancing skill sets of students. I think this is probably some of the most challenging part. And that really relies on you sort of observing enough of the group to sort of gauge where people are and consider whether some people could help each other. Oh, that's right. You had a really great, the data table. The way you organized that was actually pretty clear. And you were talking about not being so sure about how to get that together. Why don't you guys talk about that? So it's trying to pair people up to give each other some help in that working time, perhaps. But you have to be cautious that you don't want the folks that have excelled to have to do the work for their peers that are really struggling. You got to use the writing center. You've got, you want to use your time as a facilitator. You don't want to repurpose your learners to always be doing the work for each other. But they should help each other. There's a balance there. But I think you're pretty much going to have either less skilled or unprepared versus more skilled and prepared, some combination of those issues. Everybody's at the same level of training in these groups, so that's good. So you're not dealing with third year and first years at the same time. Do people have any other thoughts about that balance piece? I think that's like the hardest part as the facilitator is when you're like the idea of being on the balcony, you're sort of watching what's going on and the flow of it and how do you intervene to kind of have things move forward as best you can. It's the process and the content together. And we talked a lot about the structure. And And I think at the end of the case, there's sort of just some reminders of some of the things that we talked through. They're from the original case, so some might not entirely line up. But I also have this other, two other things actually. So Amy has a copy of an article that's, did you get a chance to copy in color?
I didn't.
Okay. It's a little harder to see in black and white, but it has nice pictures of little dots that,
The second
that
page.
describe different techniques for small groups. You would never, ever want to do all these techniques in like one session. That would be ridiculous. But includes like dyads and there's the group round we talked about before, and then there's the one I like is like you answer a question, then you pick the next person to answer the question, and so you sort of integrate across the group that way. So these are just some other techniques if you feel like as you're going through the session things are getting a little stale and you want to shake it up a bit. So that's a resource for you.
So we can send it to you in color.
Yeah, I'll send it to you.
Email.
I mean, you can sort of skip the gist, but it's kind of fun in color.
Yeah, put on canvas.
And then the last thing is that this comes from sort of the workshop that we do for the academy.
I can make copies or.
So this essentially what it does is it's just sort of a reminder of, as a facilitator, when you're trying to prepare, so particularly for those of you that are new to this, what are the sort of main things that I want to be doing? I want to spend time getting the expectations set. I want to promote a safe and collaborative environment. I want to be engaging. I want to make sure that I cover the content well. And summarize things and spend time at the end really conceptualizing what the main lessons that were that came out of the time together. So that's just another resource for you to review as you go through. And I encourage you to think about, there's always two levels of things. There's one, getting the students to where they need to be, but it's also a little bit about you in terms of refining your skills and what you've done. And that's what makes it fun to sort of keep on growing in your own skill set as an educator. So with that, we're definitely out of time again now.
Really
out of time.
Thank you, Wendy.
Thank you so much. Thank you so much.
All right, Guy. Oh, he's gone.
Business was Kyle's question of what's the bar for the writing center?
Well, let me talk to